In one of my videos, I briefly explained the types of cerebral palsy that I have. However, I haven't given a detailed explanation of cerebral palsy as a whole. Cerebral palsy, abbreviated CP, is a very broad term to describe a specific type of movement disorders. Cerebral, meaning that the disability causes damage to the cerebellum, the part of the brain that controls muscle movement. And palsy, meaning a movement disorder. CP can be as mild as causing a slight limp to something as severe as causing mental retardation. CP can be caused by lack of oxygen before, during, or shortly after birth. Head trauma causing a brain hemorrhage. Premature birth, among other things that can cause brain damage within the first few years of life. There is no cure for CP. Someone who has CP will have it for the rest of their lives. CP does not get worse as a person ages, but it also doesn't get better either, and it does not affect a person's lifespan. It is not genetic, and it doesn't directly affect fertility. There are three main types of CP. There's spastic, ataxic, and athetoid. Spastic CP has 5 subcategories. Hemiplegia, which affects one side of the body. Diplegia, which only affects the lower half of the body. And quadriplegia, which affects all 4 limbs. I'm going to stick with discussing the types of CP that I know best, which are spastic diplegia, spastic quadriplegia, and athetoid. Some people who have spastic diplegia are able to walk on their own, or use crutches or walkers to help them keep their balance, while others may require the use of a scooter or wheelchair. Most people who have spastic diplegia have some type of surgery during childhood. Some surgeries include hamstring lengthening, heel cord lengthening, and various hip surgeries. The muscles in the legs sometimes become shortened from the spasticity, and they need surgery to help them walk better or to avoid future problems. A lot of people with this type of CP also have hip problems and joint pain. What happens is, when someone has a lot of spasticity in their lower body, the spasticity sometimes causes their hips to dislocate. Spastic quadriplegia is the most severe type of CP. Like I mentioned earlier, this type affects all 4 limbs. People who have this type have rigid limbs and often have little to no use of their upper body. All people who have a moderate to severe form of this type of CP use wheelchairs. Most use power wheelchairs because they're unable to push manual wheelchairs independently. People who have no use of their upper body usually drive power wheelchairs with a head control rather than a hand control. Some people who have mild to moderate spastic quadriplegic CP have use of their upper body. I personally have never met a person with this type of CP who had difficulty speaking. The people that I know either speak clearly or are unable to speak at all and depend on some type of communication device in order to facilitate communication. People who have spastic quadriplegic CP typically need hamstring lengthening, heel cord lengthening, or various hip surgeries at some point in their lives. Scoliosis is also common in people who have this type of CP. Poor trunk control leads to poor posture, which leads to a curvature of the spine. People who have scoliosis often need surgery to prevent it from getting worse. Joint pain is also common in people with spastic quadriplegic CP. Some with severe spastic quadriplegic CP have difficulty chewing and swallowing, which can make eating orally dangerous. So, People who have these difficulties usually have feeding tubes. Some people who have Spastic Quadriplegic CP are mentally challenged. Nothing like drooling or the inability to speak is an indication of mental impairment. Those things are physical. Yes, someone who drools or is unable to speak can be mentally challenged, but just because someone can't speak or they drool doesn't necessarily mean that they are mentally challenged. Athetoid CP involves all four limbs and causes involuntary movements. This is pretty much what I have. People who have this type of CP have difficulty controlling their limbs and have difficulty speaking, or are unable to speak at all. The muscles in their faces and tongues are affected, causing the speech difficulties. Breathing also plays a part. People who have Athetoid CP generally don't take very deep breaths. So, that also makes speaking difficult. Balance is affected also. Some people who have Athetoid CP are able to transfer themselves without assistance, or walk a little bit on their own. Others can walk with assistance. Some are not able to walk at all because they don't have enough control over their legs or are unable to bear weight. Joint pain is also common in people with Athetoid CP. Some people who have CP have a combination of different types. I technically have a combination of Athetoid and Spastic Quadriplegic CP. I would say that for the most part, I'm an Athetoid. However, it's when I become nervous or excited that my spasticity kicks in. For example, I can walk fairly well with help under normal circumstances. However, when I get nervous or excited, I can be in the middle of walking and all of a sudden, my legs will get really tight, and I won't be able to move them. In my specific case, I have much more control over my left arm than I do over my right arm. My right arm kind of has a mind of its own. It flies wherever it wants to, when it wants to, and I have very little control over it. Fortunately, I can control my left arm very well. I have no problem driving my power wheelchair, and I can operate a computer fairly well with the proper adaptive equipment. Now that I've given you a rundown on specific types of CP, I'm now going to discuss some other things that can occur in people with CP. Some people who have CP are visually or hearing impaired. Epilepsy sometimes occurs in people who have CP. Some people who have CP have a severe startle reflex. Every human being has a startle reflex. It's what makes someone jump when they physically get scared and sends their heart rate through the roof. In some people who have CP, their startle reflex is constantly on overdrive. Any sudden noises or flashes of light can startle them. I have a severe startle reflex. Fireworks, fire alarms, and buzzers at sporting events startle me badly. It's not because I'm psychologically afraid of them, it's purely a physical reaction that I have absolutely no control over. When I hear them, my body reacts violently. The noises don't necessarily have to be loud to startle me. Something as minor as a calculator falling on the floor can startle me. What's really important to know about CP is that it affects everyone differently, even if people have the same type of CP. For example, two people can have Spastic Diplegia, but one of them may have the ability to walk on their own, while the other one needs to use a wheelchair. Or some people with this type may be able to walk short distances, but may need a scooter or wheelchair to get to places that are further away, while others are able to walk long distances without the use of a mobility aid. Someone's type and degree of CP depends on where their brain damage is located and how severe it is. I believe my brain damage is located in my cerebellum and cerebrum. I just want to quickly clear up something. When people hear the term brain damage, many automatically assume that it causes mental impairment. This is not always true. The human brain controls more than a person's intelligence and can be damaged without affecting someone's intellectual capabilities. Although there is no cure for CP, there are medications and therapies that can make symptoms more manageable and help the person to lead as much of an independent life as possible. People who have a lot of spasticity may be prescribed muscle relaxers or antispasmodic medication. Sometimes, Botox injections are used to treat tight muscles in a person's extremities. Physical therapy can help stretch or strengthen muscles. Occupational therapy can help a person's fine motor skills, and occupational therapists can often suggest adaptive equipment that can help the person perform daily activities independently. Speech therapy can help a person who has difficulty speaking or who can't speak at all figure out the best way to communicate. Whether it's through the use of a simple letterboard or a device such as a Dynavox. Many people with CP can lead relatively normal lives. What I mean by that is people who have CP can go to school, attend college, get employed, have relationships, get married, have a family, and things like that. Depending on a person's degree of CP, they may require aids to help them perform daily activities. I really hope that you enjoyed this video. Thanks for watching.